We're in the OR and our mom has just given birth to a baby via C-section. She's been doing skin to skin for a while and we don't want to interrupt that. So we're going to show you a way to get the PATRAN under the patient and transfer him off the table, holding the baby during the process. We've cocooned our patients with the linen and we've laid our PATRAN over the patient's legs. We're getting ready to fold it up so that we can do the unfolding method of insertion. We're going to start by folding up the PATRAN 3 times or so it's in fourths. We want the flap to be on top of the roll, facing the head of the patient. We move to the patient's head and we're going to slide our folded PATRAN underneath the patient's linen. It could be a pillow, they could have a pillow too. And we're going to pull it down until the top of the PATRANbari is in line with the patient's eyes. Don't worry about this top flap, that's going to stay with the weight of the patient. You want this whole bottom bunch of the PATRANbari. On the count of 3, they're going to pull down towards the patient's hip and it's going to get tight.
1, 2, 3.
Now they're going to grab the next corner and they're going to continue to unfold until it's completely unfolded under the patient. Before we lateral transfer our patients, we're going to assess the mom, make sure that she is alert enough to hold the baby during the transfer. If there's any concerns, the birth partner or a baby nurse can go to the head of the bed and guide the baby over during the transfer, or pick up the baby and just for a split second while the transfer is done and put the baby right back on the mom's chest for skin to skin. We're ready to lateral transfer the patient and it's going to be a pull-only transfer. Our patient has had a C-section, so she can't be pushed on. If you're on an OR table that has no rails, someone should be on this side of the table to spot the patient, but the pullers will be doing the work transferring the patient over. Our pullers are going to grab the linen, stretch it out, and roll it up, and then roll the PATRANbari up with it. They're going to put one hand down to brace their back, and then perform a very slow pull on the count of 3. 1, 2, 3.